We turn our attention now to the low-income Americans who are bearing the brunt of the coronavirus fallout.
Detroit, already facing steep economic and racial inequalities, has emerged as a coronavirus hotspot.
Time. It's a weird thing. For some, it's slow, and for others, it's gone in a moment. But the dedication and time that United Way for Southeastern Michigan and its partners have invested into communities has never stopped.
We know that 43% of Michiganders have been impacted or unable to meet their most basic needs from our ALICE report. But when you start to look at this through a racial lens, 60% of Black Michiganders are unable to meet their most basic needs.
And then COVID hit. With businesses and schools closed and unemployment claims skyrocketing, the situation became dire. Understanding the community's needs, United Way immediately began to mobilize and help by launching the COVID-19 Community Response Fund.
It's so impactful when you see a community come together, and really a community saw the important role that United Way could play in administering and managing and being fiduciary around this response fund. The fund has raised over $35 million, and that's the contribution of 75 corporations and foundations and individuals. You know, we've had well over 1,000 individuals donate their own money in support of COVID in the response fund.
Through our Community Response Fund, we've already helped 650 organizations and served more than 2.3 million people. We've also helped to serve 15.3 million meals and distributed more than 200,000 pieces of personal protection equipment.
When this hit, and lots of people with big hearts called up and say, how can I help? On the healthcare side, Dr. Hudson and the United Way of Southeastern Michigan said, we'll take the lead. And they have been phenomenal.
The results? A coordinated effort of volunteers, corporations, and community members that worked tirelessly to make a difference. This included distributing food and school supplies, providing children with technology and resources to learn, helping homeless shelters and child care facilities stay open, and supporting families so they can stay in their homes and keep their lights on.
Every 2 weeks, they give me enough groceries for myself and my son, as well as recipes so that we can eat.
But like time, COVID pushes on and continues to significantly impact members of our community and show areas for improvement, like the gaps in social support systems and inequities that disproportionately affect Black families and other people of color. So what do we do next? Well, it's clear that families still need help. And when we stand united in support of a common cause, we can help families meet their immediate needs and work toward long-term solutions. United Way is focused on helping families get out of crisis and stay out. We can help households become stable by focusing on food, housing, healthcare, and finances. And we can help children thrive through access to quality education, technology, and wraparound services. When you join United Way's mission by giving, advocating, and volunteering, you help ensure that households are stable and children have the opportunity to thrive. The time to create change is now for our children, our families, and our community. We will recover, and we'll do it by standing united.